Hello, I'm here. This is an executive report on Amylin. 1. We will review the science, briefly touch on real-world evidence, then delve into the market, emerging agents, current and future indications, and finally the competitive landscape. So let's start with the basics. Amylin, also known as islet amyloid polypeptide or IAPP, is a 37 amino acid peptide hormone co-secreted with insulin by pancreatic beta cells. It's been well established that amylin regulates glucose homeostasis by slowing gastric emptying, suppressing glucagon secretion, and it promotes satiety. Pathophysiologically, it is implicated in type 2 diabetes mellitus, 𝗕𝗘𝗫𝗓, and obesity. Specifically, amylin aggregation is believed to contribute to beta cell dysfunction and islet amyloidosis. Interestingly, amylin analogs have shown to reduce food intake and body weight, making them potential therapeutic candidates for obesity. Furthermore, its interaction with the Alzheimer's disease-related amyloid beta, 𝗕𝗏 peptide raises interest in its role in neurodegeneration. Real-world evidence RWE. Several observational studies and claims database analyses have demonstrated that patients treated with amylin analogs, such as pramlintide in conjunction with insulin, show improvements in glycemic control and weight loss compared to those receiving insulin alone. 3. We have the approved amylin analog, pramlintide, also known as Amylin, which is currently marketed by AstraZeneca. It was initially approved for use as an adjunct to insulin in type 1 and type 2 diabetes patients. Pramlintide has a rapid onset but short duration of action, necessitating multiple daily injections. Then we have the emerging agents. Cagrilintide, a long-acting amylin analog being developed by Novo Nordisk, has shown promise in combination with semaglutide for the treatment of obesity and type 2 diabetes. Notably, positive results from the SELECT and STEP-TEENS trials are expected to fuel uptake upon approval. Additionally, dual amylin calcitonin receptor agonists, DACRAs, are being investigated for their potential to enhance satiety and weight regulation. In terms of the market, the amylin therapeutics market, valued at approximately $650 million in 2023, is projected to grow at a compound annual growth rate (CAGR) of around 12% through 2029. Key drivers include rising obesity and type 2 diabetes prevalence and the synergistic action of amylin with GLP-1 receptor agonists. However, challenges remain, including the injection burden, gastrointestinal side effects, and limited adoption of older agents like pramlintide. The current and future indications for amylin include diabetes, type 1 and type 2, obesity and metabolic syndrome, and Alzheimer's disease, which is still largely exploratory and preclinical. 5. We have the novel modalities targeting amylin. These include RNA therapeutics such as small interfering RNA, siRNA, targeting IAPP mRNA. These are in early stage models and they aim to prevent amyloid-induced beta cell death. Amylin mimetics, which are designed to improve the pharmacokinetic profile of amylin, for example, by pegylation or fusion protein approach. These efforts aim to create analogs with longer half-life and reduced injection frequency. Gene therapy approaches are also being explored, such as beta cell-targeted gene editing to correct amylin misfolding or overexpression. Finally, small molecule aggregation inhibitors are under investigation to disrupt the formation of toxic IAPP oligomers. And lastly, strategic R&D collaborations with GLP-1 agonists represent a significant avenue of research. For instance, Novo Nordisk's development of Cagrilintide, a once-weekly amylin analog in combination with semaglutide, the active ingredient in Ozempic and Wegovy, has shown promising results in the Amplitude and Redefine trials for type 2 diabetes, highlighting enhanced appetite suppression, glucose control, and weight loss compared to semaglutide monotherapy. Combination trials with amylin analogs are underway, including dual or triple therapies with GLP-1 RAs and GIP analogs, such as tirzepatide. Moreover, shared delivery systems such as auto-injectors and sustained-release microspheres, are being explored for fixed-dose combinations of Amylin GLP-1 co-formulations. Novo Nordisk and Emisphere have partnered to investigate oral peptide delivery platforms for co-formulated Amylin GLP-1 analogs. Additionally, academic industry consortia are pursuing joint preclinical programs to develop intervention platforms for metabolic disease using amylin biology. In summary, amylin biology is being redefined with next-generation analogs and novel modalities aimed at enhancing efficacy and reducing treatment burden. Real-world outcomes support the role of amylin in glycemic and weight management. Strategic co-development with GLP-1 analogs is transforming metabolic disease management, and upcoming combination therapies hold potential to redefine treatment paradigms for diabetes, obesity, and neurodegeneration. Thank you for watching. I hope this was helpful. If you have any questions, please leave them in the comments below. Stay tuned for more content. Thanks again.